When most people hear the word hospice, they think of it as giving up or the very last days of your life. But here's the truth. Hospice isn't about how you die. It's about how you live your final chapter with the comfort and dignity that you deserve. Today, I'll talk about what hospice really is, when it's used, who pays for it, and why it might be the most compassionate choice a family can make, especially in the cancer world. And if you're new here, my name is Jelena, and I'm a stage 3 rectal cancer survivor. This is one of those topics that can feel a little heavy, uncomfortable, or even taboo, but it doesn't have to be. Whether you're a patient, a caregiver, or someone who just wants to be informed, this video is for you. What exactly is hospice? When treatments can no longer control the cancer, that's when the focus of care can shift. Hospice isn't about giving up. It's about shifting that focus from treatment to managing symptoms. The goal is to make sure that your final days are spent in comfort, surrounded by the ones that you love. Hospice is a family-centered service where you and your loved ones are the ones that are making the decisions. It supports not only the patient, but also the caregivers and loved ones, both emotionally and physically. And no, hospice doesn't mean that care stops. It means that it changes to treating symptoms like pain, anxiety, nausea, and breathlessness. Some people be in hospice because treatment is no longer working for them. Others choose hospice because treatment does work, but the side effects are just too much. And for others, it's a mix of both. Usually, it begins with a conversation between you, your caregivers, and your doctor. It means the focus of care shifts to comfort and quality of life instead of trying to control the disease. You might hear that hospice is intended for people who are expected to live 6 months or less. But that's just a guideline. It's not a countdown clock or a guarantee. And here's something important to know. If someone happens to live for more than 6 months, they will not get kicked off of hospice. As long as they continue to qualify for it, they'll continue to receive it. And in rare cases, if someone's condition improves, they can pause hospice and restart it later. It's important to know that hospice does not mean that someone is giving up or that they're dying tomorrow. It means that the goal of their care has changed. One of the biggest questions is, where does hospice happen? And the answer is wherever you feel the most comfortable. There are 4 different options that are available. One is home. A nurse will visit the patient and their family and help with creating a plan. There's usually a nurse that's available 24/7, so if any questions or concerns arise along the way, they're available for help. 2, hospitals. If the patient's needs are too high or too specialized for a caregiver or family member to handle at home, a hospital can meet those higher demands. Some hospitals have a special hospice unit, while others have hospice staff that will visit the patient in their regular hospital room. A freestanding hospice center. Many communities have hospice houses, which are dedicated facilities that feel more like home than a hospital. Many families will choose this option if they live at home with their family or other members and do not want to pass away in the family's home. 4th are nursing homes. Many have specialized units or work with hospice agencies to provide the same level of care as, say, at home or a hospice house could. You aren't alone in this. Hospice care provides an interdisciplinary team, and this team can include specially trained hospice physicians, hospice nurses, home health aides, social workers, and chaplains. It's a full support system for both the patient and their family. Thinking about the logistics can be stressful, but generally, hospice is covered by Medicare, Veterans Administration benefits, and Medicaid. Most private insurance policies also will cover hospice, but you'll want to check the details of your plan to find out what is covered. The good news is that hospice care is generally far more accessible than people expect. Earlier hospice can mean better symptom control, fewer emergency room visits, more support for caregivers, and more meaningful time together. Hospice isn't about giving up, it's about shifting the focus to quality of life. While hospice is designed for the final 6 months, you can stay on it for as long as you need until the end of life. And here's something that people don't always know. Patients can sometimes experience a rebound or a revitalization when starting hospice because their pain and symptoms are being managed so well. If that does happen, patients can always withdraw from hospice and restart later if they need to. It's flexible because life is unpredictable. Hospice is about making sure that the end of the story is written with as much love and peace as possible. If you or a loved one are facing these choices, I hope that this video has helped clear up some of the questions that you may have had. If you're looking into different treatment options, you can check out this playlist to hear from other cancer patients like yourself and what treatments they have done. Thank you for watching.